About 70% of the folks in the ACE study had some category of the ACEs that they experienced as kids. 70%. That means only 30% of the folks walking around really have close to a 0 ACE score. And when I say 70%, that means that there's many of us in the helping professions that come with our own trauma. And I think that's really important to understand. Because when two people are in that survival mode, that fear mode, that need to keep themselves safe and not feeling trusting of those around them, we're more likely to have difficulties in conversations. So it is extremely important that we as staff have an understanding of our own trauma and our own stress and have found ways to care for ourselves and to seek the support that we really need. And I'm going to turn to supervisors and leaders. I mentioned before about having staff feel like they have to make somebody do something. And the reality is that none of us can make another human being do anything, short of putting somebody in jail and holding them there. So if that's the case, then what do we need to do? We need to build a relationship with them. A relationship of trust and safety where they can find the courage, with our assistance, with our affirmations, with our skills that we have in conversation, to help them find a direction of better wellness. It may not be the perfect way that you imagine it, but something that's better for them, that they're willing to do. As supervisors, I would suggest that the skills I'm talking about, safety, trust, collaboration, empowerment, giving choices, are the same skills that we as supervisors could and would benefit from sharing with our staff when we're supervising them. I had just mentioned that many of us come to the field with our own trauma, and in fact there is some research and some evidence that in healthcare there's a higher percentage of folks with trauma that come in to work in healthcare. So if we're supervising staff that bring their own trauma, it's really important that we offer them the same trauma responsive environment in which to work as we are asking them to give to the person they serve. In fact, it's almost impossible. If it starts up here in a very directive, non-compassionate, kind of not recognizing people as trustworthy way, and that goes down to this level of staff and supervisory or whatever, and down to this level, it's very unlikely that we're going to be able to treat the people we serve the way we'd like them to be treated. Because everybody else's anxiety is escalated when they don't feel that they're working in a transparent, safe, trustworthy environment. How do you invite them to find their own solutions? When something's not quite working the way you want, and you say, this is what we need here, how can you help me with that? And elicit from them how things can be different. It's very different than handing somebody, this is what you have to do, and then expecting it to be done. If any of you out there are finding that that works really well, carry on. But what we find mostly is that people who are involved in what it is we'd like to see them do differently really are more likely to make those changes and really take ownership of that. So in working with trauma, one of the things that I started to think about was primary, secondary, and tertiary prevention or intervention. And I thought, geez, I wonder if I could divide this up. Like, what can we do in the primary prevention, which would be that prenatal and very early childhood piece? What could we do in what I viewed as secondary intervention during child's school years, where we have another adult coming into their life that could be that caring adult that would help them get through very toxic kinds of stress without too much long-term damage. And then the tertiary, which is the adult who's gone through all of this and still has not been able to have the kind of support and relationship and interventions that have helped them to cope with the trauma that they experienced as a child. I thought, that sounds not too complicated, and yet then I started to think about what all I know about infant mental health. and development. For us to do the prevention with that infant, I think we have to do tertiary intervention, don't we? Because that infant has a parent. And it's quite likely that if that parent has had a lot of toxic stress or trauma themselves, their ability to parent that infant in a way that would minimize toxic stress for that infant, maximize healthy development for that infant, it's going to be difficult. So in essence, when we're doing primary prevention with that infant, we're often doing tertiary prevention with the adult. So there's a big deal, and actually I've had the honor of working with Nurse Family Partnership in the Monroe County area. Nurse Family Partnership is a group of nurses that go into the home to work with young women while they're pregnant, usually as early as they can be, like about 3 months, and stay with that woman in her home, visiting once, twice a month, 4 times a month in the beginning, in her home until the child is 2 years old. Giving that initial beginning, that would be my primary prevention time for that child, to be able to offer the support, the gentle guidance, the things that will help this mother maximize her skills as a parent and minimize the impact of any toxic stress that she's had. And I've been watching this over time and really understanding how important this is to our having this change, right? This is the place where we can really make a difference, and it's going to require that we give the same care to the parent that we give to this child, infant, the same safety, the same trust, the same collaboration, choices, all of the things that we know are trauma responsive. So secondary I want to talk about just for a moment, and that's when the child goes to school. And now we have another adult coming into the child's life. School teachers, much like healthcare providers, have a big job to do. Teaching a number of children and feeling stress coming down, that they're being judged by the outcomes of the children. Another instance where you really have no control in many ways. You don't have control of the social issues that child has, the trauma they may have experienced, all of the things that make teaching extremely difficult. But they're being judged by that, and so they have higher anxiety about that. And here's this child that's dealt with this trauma. So we are working, and hopefully most counties are working hard with the schools to give the teachers the support that they need to be able to find other ways of working with the kids that are trauma responsive, that really help these children feel safe in that environment, that really help these children see possibility and hope instead of feeling like, you know, I'm the kid that's always being sent to the office, I'm the kid that's always getting into trouble. Finding ways to make that work better within the school system. So these are the areas I think that we can think about in our own communities. What can we do from a primary prevention with those prenatal and early childhood times? What can we do in our schools as a secondary prevention? Greeting the kids at the door in the morning and calling them all by name and saying, good morning, I hope you have a great day. A lot of classrooms are starting to do a mindfulness or just some quiet time at the beginning of the day. So there's lots of ways to help start the day differently for kids that have experienced a lot of trauma. And then the tertiary piece. I want to say this. One of the things that concerned me, and I think it's one of the reasons why the ACE study took so long to become as important as we now know it is, and the one thing that concerns me about all of this is that we would start to blame the parents. If we go into that mode, we have absolutely no hope of helping that parent grow in the way we hope they would grow to give that child the support they need. If it becomes that adversary kind of role, it's going to be very difficult for you to change the experience for that child in the home. The parent has to be a partner. I ask this question, and I understand there's huge variation, but which one of us has done our parenting job absolutely perfectly? And which one of us can say we've never made a mistake? It's a challenge, even for those who haven't experienced a lot of trauma and toxic stress, to do parenting in a really effective way every single day. So we need to partner with these parents to understand that they come with their stuff, and how can we partner with them and help them do the very best with that child that they have, that they would love to see grow, because that's what most parents want, is a healthy kid with a healthy outcome. Thank you very much.